Assalamu alaikum, Ultrascan Diagnostics. Say this is the CBCT of the patient that you had requested. The area of interest is the lower wisdom teeth. Now we're going to start with the lower left wisdom teeth. We're going to show you the transaxial view, which is basically the proximal view. Now this is the crown of the tooth, the lower left, the 3-8. As you can very clearly see, the orange highlighted area is where the inferior alveolar nerve is. As we move towards the mid tooth level, this is where the roots have started. As you can see, we've got the mesial root at the bottom and the distal root on top. As we are moving further into the ramesh, you will actually appreciate how the inferior alveolar nerve comes in close contact with the mesial root of the wisdom tooth. And as you're moving towards the apex, you'll see that the inferior alveolar nerve gets compressed by the apex of the wisdom tooth. Right there. So there we go. This is the lower left side. As you can see, the apex is very close to the inferior alveolar nerve. Along with that, you also appreciate that the tooth is mesioangular horizontal impaction and is completely embedded into the ramus. Only the crown portion is out. This is something to be mindful of. Now we're going to move you to the lower right wisdom tooth. The lower right wisdom tooth is also horizontally impacted, but the crown portion is completely out of the ramus. As you can also see on this portion here, we don't have any bone covering this tooth. Moving towards the distal side of the apex, you can actually see that the roots are covered by the ramus completely. The inferior alveolar nerve is significantly far away at the mid root level, but as we move closer to the apex, you can see the inferior alveolar nerve comes close but does not come in contact at any point. So this is also something that is significantly beneficial for our doctor. We're going to show you quickly the sagittal view, which is basically the side to side view. So this is the sagittal view of the left side. Here you can see the inferior alveolar nerve is being compressed by the wisdom tooth quite clearly, and you can also see how much bone coverage in the ramus of the wisdom tooth is actually present. When we move to the lower right side, you will again appreciate that here the wisdom tooth is significantly far away from the inferior. Only the apex is close but not in contact and not compressing. Thank you very much.